It's basically an office. So
Okay, no problem. And here we go. Hi, Joel. How you doing?
I, I'm doing well, thanks, Peter.
Great. I appreciate you taking the time with us today. Um, Wondering if maybe you can start out by telling us a little bit about your organization, and then uh, move into how you guys use big data.
Sure. So I work for Bay State Health. Bay State Health is a large health system, integrated health system in Western Massachusetts. So it's basically, if you will, in the shadow of many other tremendous healthcare organizations in Massachusetts, but it's actually a gem here in Western Mass. It's about 11,500 employees, five hospitals and growing, roughly 80 medical groups. And we also have a health plan that we own, which is very unique, but also becoming the norm in the world of healthcare reform and ACOs.
Sure.
It's a fairly good sized organization that services Western Mass and some level beyond.
All right. Great. Can you provide an example of how you guys use big data?
Sure. So let me just sort of uh, set the stage by saying that I believe that we're still in the process. I think just nationally in the healthcare industry of using big data. We're not really, I'd say, at the big data level. Maybe mid-sized data, maybe even little data. And a lot of it is because we're still challenged with liberating what I like to call liberating the data, which is really extracting the data from our source systems, our legacy EHR systems, ERP systems, etc.
Sure.
And also challenged with creating data liquidity, which to me is standardizing the data to ensure information exchange. Um, but in terms of data use, analytics use, which is really our journey towards big data, we have begun to use it a lot more, and a lot of it is because of things like trying to manage our patients at risk, trying to manage our bundled payments in our ACO, right? So looking at where our patients are going, who's providing care to them. A lot of this utilization metrics, which is really sort of embedded across the region in disparate systems, are things that we now have to aggregate
Okay.
and we have to sort of collect and begin to create analytics for. Additionally, we're using big data to identify um, process improvement in our organization. One of our biggest issues right now, and I think this is a national issue, is wait times in the ED, but sort of complicating that are wait times in the inpatient setting, discharges, etc. Right,
Sure.
longer discharge times, length of stays. So we're using big data analytics to really identify where are the choke points, where are the limiting factors in our process that we can begin to say, hey, this process needs to be improved. We need to have more resources here, or we need to do discharges differently and to perhaps different areas of the region so that we can ensure more rapid movement with our inpatients and our ED patients. Um, Additionally, we use big data now to identify what services should we be offering to our patients. I think traditionally, hospitals have just tried to be hospitals, care for your region,
Sure.
right?
Sure.
But now we have to really be aware of utilization, costs of care, and we have partners that are uh, across the region who we don't own that are doing things like primary care, or they're doing non-tertiary required procedures. We want them to keep doing those things, so we should hone in on our side. What are the things that we do the best? What are the things that are most cost effective for us? And so analytics of that nature allows us now to be, in some level, more like product managers. Identify the services that are most appropriate for a tertiary or quaternary care hospital like Bay State Health.
Okay. Makes sense. How would you like to see it then continue to evolve, and what do you think some of the key challenges are as you continue to grow your use?
Well, like I mentioned in my sort of opening, data liberation, data liquidity are to me the biggest challenges. There's a lot of legislation now with regards to interoperability, and the ONC, the Office of the National Coordinator, just released their 10-year interoperability roadmap, right?
Right.
And Meaningful Use 2 and Meaningful Use 3 are also looking at better ways to create requirements and certification for interoperability. I myself have been on a number of committees, and also actually last week was up at DC, or down in DC rather, lobbying for open APIs, lobbying for better interoperability by our vendors, and also lobbying for more legislation that pushes these vendors to really open up their databases so that we can extract that data and have use of that data more readily. So the challenge right now is at some level accessing that data and making sure that that data has high integrity, because we're now in an age where we've got great tools, great visualization tools, a lot of intelligent platforms.
Sure.
The data is the key piece, and that's largely what's missing right now in terms of really getting to big data.
Okay. All right. Any lessons learned that you could share, for some of your peers who maybe are just starting to ramp up?
I think the biggest lesson is to make sure you've got data governance right out of the gate, and I'm sure that's a lot of what many folks who've experienced this like to articulate. And it's important because you want to make sure that number one, you've got a unified vision of what analytics and big data means to the organization.
Sure.
We went right out and said and called our analytics platform Center for Analytics, because we want to make sure that, hey, let's bring everybody into a central platform so that we're not having pockets of analytics here and reports there and here. Integrity of data and at some level consistency of analytics and reporting is important to ensure that number one, you're all looking at the same information,
right,
and number two, you're all trusting the same stuff, right? So governance is important for unification, but it's also important for success, because everybody's going to want what they desire to have and what they need, meaning their department has analytic needs. You want to make sure that governance says these are the highest priority things and what we're going to be doing in the next 12 months, and then the other things will be done in the next 18 to 24 months. You don't want people out of the gate to be disappointed that you were not able to deliver
right,
their requirement, but instead you want to say governance has suggested that this is where we need to go first,
mm-hmm,
and this is the most important thing to the business, and so that's what we're going to build out of the gate. So to me, governance was the biggest thing. And then the second, of course, is back to, again, the most important part of this is focusing on data and the quality of the data and making sure you've got the data standardized, because we can talk all day about all the great tools that are out there, but if the data is, low quality,
right,
then your analytics is going to be of low quality.
Okay. All right. Long term, how do you see big data impacting healthcare overall?
Oh gosh, I think if we truly got to big data, which is where some other industries have really begun to get to,
Mm-hmm.
meaning getting data like signal data from wearable technologies, data from everything from loyalty databases that are part of a grocery store, connected with perhaps a diabetes registry that Baystate has of its patients, to social networks that collect sentiment of patients. What I envision is that once we really get to that kind of data consumption, which is from all of these things that are now collecting data, the internet of internets, right? The
Yeah.
internet of things, right?
Sure.
We can really start to hone in on true personalized medicine.
Okay. Great.
And I do think that that's really where we need to go with this, is to be able to say, for a particular segment or a particular part of the population, this is how we need to provide services, or what services we need to provide to them. The uniqueness of that individual, I think, is going to be much more achievable in the way that we deliver care once we achieve true big data capabilities.
Great. Great. Yeah, I appreciate you taking the time.
It's my pleasure. It's always fun to talk about data and the challenges that we have with analytics. Information is definitely key for better healthcare delivery for our future.
Great. Have a great day.
Okay, thanks a lot, Peter.
Thanks.